Hi guys! I know it's been a little while, and I know everything is weird, the light is weird. I'm not gonna worry about it too much. Today is actually the first day in my um, working history at my office. So, the first day in 17 years that I've gone to work without like a full face of makeup on. I didn't put foundation on today. And yes, it feels really weird, but also feels really nice. And nobody stared at me like a monster having my full rosacea out. So I'm not going to worry about it. Anyway, I had a whole bunch of videos that I wanted to make, and this is not really one of them because I did no preparation. So I do want to make like a favorites of 2017 video. I wanted to make, of course, an regular update video, which I'll make this one a little bit. Um, yeah, so anyway, I had a whole bunch of videos I wanted to make, and every year, for like the past 4 years, I think I'm gonna do Vlogmas, and I get so excited. And I somehow always seem to forget that December is like the craziest, busiest month for me at my work. And Vlogmas would just be me driving to work and then driving home from work and going to bed. So Vlogmas is not really a thing that I can do, but I want to do it so bad. It's just, I love watching everyone's Vlogmas. It's so fun. So, blah, blah, blah. Anyway, very short update is that my dog, Zevon, recently had knee surgery and he's doing really well. He had it like 2.5 weeks ago. He just had his stitches out and he's walking around pretty well now. This is his 5th major surgery and his 2nd knee surgery. So, first on this knee. But he's doing really well, so that's good. It's been keeping me very busy because I need to take him out, versus just opening the door and letting him go. I need to suit up with my hat and my gloves, and I need to take him out on the leash. So, yeah, it's a pain in my butt, but he's a very cute pain in my butt. So, anyway, this video is actually in response to a bunch of questions that I have gotten, which is, what are my symptoms? So a lot of people know that I am going through all this testing and doctor's appointments to figure out what I have. I do have Ehlers-Danlos syndrome, which is a connective tissue disorder. And I'm sure you have, if you know me, which most of you do, you know this, and you know that that has a myriad symptoms on its own, and that usually accounts for, like, specifically joint pain, like my hips or my knees or my shoulders will subluxate, which is like dislocate, but like halfway. So they come out of their sockets basically, and then repeatedly go back in, like, throughout the day. And so that causes a lot of arthritis and joint pain in general. And aside from that is something new that's flaring up that they don't know what it is yet, but I've still got a lot of doctors left to go. I'm feeling pretty strongly that it is going to end up being lupus, only because of the symptoms. But it takes a long time to diagnose lupus, so it could be a while, or it could be something else, which who knows. But anyway, so people know that I'm going through all these doctor's appointments, and that I don't have any answers yet, and that I am pretty miserable in terms of the pain in my body. And the most common question is, what are your symptoms? And so I actually have a long list right on my phone, and I thought I would just tell you what my symptoms have been. I am sort of a person that likes to ignore symptoms because I have had EDS for, you're born with it, so I've had it my whole life. So I've always had like weird pains and symptoms here and there. And so when something comes up, I just say, oh, it's just me, it's just weird. And I don't really track it or worry too much about it. But since I could tell that whatever this is had like a flare up, I knew that I needed to track it for the doctors. So I have got this list. I'm sure you can't see it, but that is my list of symptoms. I won't read it all to you, but I'm just going to go through it very quickly so you can kind of get a gauge of what I mean when I say, I'm having these symptoms. And some of them, may not be related, but may be related, which is why I put them on this list. The stuff that isn't really related, that I know 100% is the EDS, I didn't put on this list, but a lot of those pains I feel like could be also caused by the inflammation. And so in general, the number one problem that I'm having is insane amount of chronic inflammation. But it's the inflammation in your body that causes all of these other things to happen. So let's see. I had a rash on my chest after sun exposure. It happened twice. It was itchy and pink, sort of like hives. Went away in 3 to 5 days, and that actually, like I said, it happened twice. But one time it was like my whole torso was just like patches of this very itchy rash. I still don't know where it came from. Then the first really big symptom slash thing that I don't know if it's related is that throat thing that I told you about. I went through all the doctors and all the tests for that, and nothing came back. So the assumption is still that it was a dislocated hyoid bone, which I don't think it is. It must be the cartilage on the thyroid, which is catching on things, which sort of makes sense because if it was higher on one side, than it should be, and that, could cause something. But if everything is inflamed, it would make sense why it would be catching on everything. So that's still happening. That's been, I don't know, like 4 or 5 months that's been happening. So every time I swallow, it feels like something is clicking and moving and is painful. Then I had my right knee went out, is what I call it, went out. But it felt like I had torn my meniscus. That has happened before, so I know what that feeling is. It's pain, but it also is like a feeling of like instability. And so that had happened, and I was wearing a brace every day, and then the other knee went as well about a week after that. So for about a week, I couldn't really stand fully on either of my knees. And that's sort of when I started contacting the doctor and said, like, something is wrong because it was both knees. Then I was having intense joint pain and stiffness in both of my middle fingers. So again, that was sort of a weird signal to me because never has my joint pain come bilaterally. Like I never get it on both sides at the same time. So it was very strange that boom, both my knees, and then both of the same finger on each hand. Then it was my toes. I was having random toe pain. in the same toes on both feet. Sort of felt like, like I had stubbed it, but I hadn't. It was just like random toe pain. Then it was my pointer fingers. Both of them were visibly swollen. This one is still feeling like I have to crack it a lot. So I would wake up and like both of my pointer fingers would be like big pink sausages and I couldn't really bend them. And if I did, it hurt pretty bad. Then it was in my arms, both of my upper arms, not like in a joint, but the upper arm. It's hard to lift my arm laterally, which is still happening now. Kind of feels like getting a tetanus shot. If you've had a tetanus shot, where your whole arm feels sort of weak and like a dull throbbing pain. Then came the fatigue, which, I know fatigue is a thing. My mom has always suffered from it. But you sort of always downplay fatigue until you've had it. Because, I thought fatigue, like, oh, you just feel a little tired. No, it was like I would come home from work and my body felt so heavy, like I could barely get up the stairs and like get to my bed, and then I could just lay there. And I wasn't even tired, like sleepy. I was just fatigued. Like my whole body ached with fatigue. That is still happening on and off, probably 3 or 4 days a week, especially in the evenings. I feel that way. Mentally, I have had a hard time recalling common words that I know and that I frequently use in a conversation, or even if I'm typing an email. I just can't think of the word, and that's not really normal for me. That one kind of came and went. It was like a span of like 3 weeks where I felt it really strongly. Like I was typing an email and I had to sit and like think and think and think of the word, like about, like a normal word, and I couldn't get it. And then I would reread the email that I wrote and I would have typed multiple words 2 times. And it's just not, that's not my normal. That one was weird. That one actually I thought could have been sort of an indicator of MS, but they have been checking me for that so far, and I don't really have any other symptoms. So, blah, blah, blah. Frequent numbness in the toes, numbness in the hands. Now I have Raynaud's, which is this thing that constricts the blood vessels in your fingers and your toes if it's cold or if you're stressed. And I live in New England and it is 17 degrees right now. It's freezing. And so every time I go outside, or if I even touch food from the refrigerator, all of my fingers from like here up, first they turn bright white and then they turn purple, like the color of my hair, purple, and then they turn bright red and kind of burn a little bit. It's not super painful, but it is very uncomfortable. It's like the numbness, but the painful numbness where it's like kind of, tingly in a bad way. I'm not enjoying that at all. My doctor told me the only cure for that is to move to Florida. So that's helpful. I had that really bad chest pain, which ended up being costochondritis, which is inflammation of the tissue in between your ribs and in between your, like your breastplate, your sternum. That was really bad. That was like every breath that I took was painful, and I'm sure that will come back again. I'm not into that. I've been easily dizzied, so if I turn my head too fast, or something like that, I kind of get a little bit dizzy, which is not normal for me. A couple days when I was in Florida, I had a lot of, I was seeing like peripheral movement in my eyes. So, like the corner of my eyes, I would see something moving all the time. But if I looked right at it, there was nothing there. That, thank goodness, has gone away. Um, let's see. Then I got the rash back, which I talked about. The problem with typing and writing, which I talked about. Then I got this. It's a gross word. I'm sorry, but feeling like there's mucus in the back of my throat as I have to swallow as I say that. I don't know what that is. If it goes along with the throat thing, or if it's not mucus, it could be something else in there. It feels like I have to swallow hard, like all day, which sucks because when I swallow, it hurts. It's just weird, especially in the morning. It's just like, feeling like there's something in your throat and you can't release it. Then my right knee went out again. I had a lot of pain at the right of the kneecap. I couldn't move my leg to the side. And then going downstairs, I had to keep my leg straight. Then I got higher blood pressure, which really freaked me out. I think I talked about that already. Doctor says that's likely not related, but it's weird because I normally have very good blood pressure. Then the throat thing got remarkably worse for about a week and a half. I had an intense pain on the right side when I would swallow. Now it's back to like the normal, but it was pretty bad. Let's see. Oh, sorry, I hit some kind of button. I went too far. Woke up with pain in the second joint on both my middle fingers, not swollen, but very painful when I was moving. So that's still happening. Basically, all of the hand stuff is still happening every day. I've got the deep pain in my right bicep when moving my arm. Right knee again, feeling unstable, lasted 3 days. Then left arm pain, upper arm, base of thumbs, and the sides of hands. I have had silent migraine a few times, which if you don't know what that is, it is not as bad as it sounds. Like, it sucks, but it's not like a migraine. They call it a silent migraine because there's no pain with it. It's more of like an ocular migraine. So what happens is basically right in the center of the field of my vision, it just goes like icy, sort of like a clear kaleidoscope of just moving shapes right in the center. So I can't actually look at anything. Like I can't see anything, like I can see I can see where I am, I can see the room a little bit, but right where I'm looking, it's always just this moving thing. And it sucks because I'm always so scared that it's going to happen when I'm driving and I would not know what to do. But luckily that has not happened. When I do get it, it only lasts, like 20 minutes to maybe an hour. And I try to take something right away to maybe decrease the time that it lasts. I don't like those. And oh yeah, so the pain in the base of my thumbs and the sides of my hands, which you may have seen my little brace I'm pretty certain that it's tendonitis. I am very much prone to tendonitis, and since tendonitis is also an inflammation, it makes sense that I would get it. It just sucks because if you ever had tendonitis, it's super painful. It's more painful than it should be. It doesn't sound like much of anything. But so I currently have it in both hands, right here and right here and like right here. This is the worst, especially on this hand. Like if I move my wrist in any direction, I get a shooting, like stabbing pain right down the side and up my wrist a little. And then if I move my thumb, then I get it right here. And it just feels like every time you move your hand, like somebody's stabbing it. That one sucks because, first of all, you use your hands for everything. And I have it in both sides, so I can't even like baby one hand while the other one is getting better because it's in both hands. Oh, it's so frustrating. So there's that, and it feels like I have torn rotator cuff in both sides. Same thing. It could be like a bursitis or a tendonitis in my shoulder, but it has, excuse me, I have a lot of tears in my rotator cuffs, and it feels very much like that. Like there's a sharp pain when I move it. There's a dull pain all the time, and then there's like a weakness in my arm, especially if I try to move it like laterally or up over my head. It's so annoying. I think, oh yeah, and then hair loss. So I have lost, I'd say, 35% of the hair on my head. It's not in like patches, it's just all over. And if I just like touch my head at all, I mean, I'll get a handful of hair. If I brush my hair, I have to clean out the brush every single time because it's just coming out. I will brush my hair thoroughly before I get in the shower, and then I'll wash my hair, and I'm left with like a drain clogging worth of hair. That also is annoying, but like obviously it's not painful, so I don't really care that much. And you know, hair's still a cool color, so I feel like it's distracting enough from it. But if I put my hair up, like you can see a lot of my scalp. But whatever, you know, and the hair, it grows back, I hope. If it doesn't, it doesn't. It's just hair. I don't really care. So basically, if you want to sum it all up, my symptoms have been pain, pain in every joint, and a lot of just inflammation. Things are swelling up, and my jaw has been really bad. I don't know if that's, you know, I have TMJ from the EDS, and just it usually is not too bad. It used to be really bad, like when I was a teenager, and it hasn't been very bad the past few years. And currently it is bad. It's painful. So anyway, that is a list of my current symptoms and what I am currently being, you know, observed for. My next rheumatology appointment is not until mid-January, so I'm just kind of waiting until then. The other rheumatologist, the one that I had been seeing, you know, she told me, oh, if anything flares up, I want you to come in right away. And I would consider that it's flaring up right now. My hands are almost unbearable in the morning. Like I can't bend them. And my knees were going out again. Like I felt like things were ramping up to flare the same way they were before. But I just don't really want to see her. And I feel like I'm going to be going to this other one anyway. So I'd rather just wait it out. Obviously, if it gets bad, you know, I'll go see her. If it gets real bad. But I'd rather just wait. You know, it's there's nothing they can do right now anyway. So, okay. So I hope this wasn't terrible. I'm sure it was. Nobody wants to listen to anyone talk about their pain for 25 minutes. But like I said, a lot of people ask me, and I think I I think they just ask me to be polite, but some people seem to be genuinely curious, or maybe they want to diagnose me, which is great. um, and so there you have it. I do hope that I can make those other videos soon, slightly more fun ones that are not about my health, because I also owe you a weight loss update. I'm sure you've noticed that I haven't been posting the meal plans of the week. I only made it, like 2 or 3 weeks. Sorry about that. It's just December, man. Like, it kills me every year. So I will be back again soon. I promise. And I hope you're doing well. And I'll see you later. Bye.